Today, we will discuss the evolving role of GLP-1 receptor agonists in people with type 2 diabetes and chronic kidney disease. My name is Ian Boer, and I'm professor of medicine and director of the Kidney Research Institute at the University of Washington in Seattle, Washington. I also practice clinical nephrology at the VA Puget Sound healthcare system. While the cardiovascular benefits of GLP-1 receptor agonists seem pretty well described now and seem to be quite consistent across EGFR strata, the kidney benefits still remain unproven. We are excited about the potential kidney benefits of GLP-1 receptor agonists for a number of reasons. And those start with secondary analyses of the large cardiovascular outcomes trials that you described. So for example, LEADER, SUSTAIN 6, and REWIND all looked at a secondary kidney outcome. For the most part, that was a composite outcome that included advancing to large levels of albuminuria or large amounts of EGFR loss or kidney failure. And those composite outcomes were reduced quite substantially on the order of 15 to 36%. Now, that is not definitive evidence that GLP-1 receptor agonists improve kidney outcomes for a number of reasons. First of all, these are secondary analyses. Second of all, this composite outcome includes both albuminuria and EGFR, whereas EGFR loss and kidney failure is really considered the hard clinical outcome that would lead to approvals and changes in clinical management. They do, however, combined with experimental data that suggest benefits on the kidney, really raise our enthusiasm for studying these further and answering whether GLP-1 receptor agonists have kidney in addition to cardiovascular benefits. What are the mechanisms through which GLP-1 receptor agonists may help protect the kidney? Well, there are a number of metabolic benefits, both via controlling blood glucose, which is, of course, a risk factor for kidney function decline, as well as non-glycemic metabolic benefits mediated through body weight and other associated mechanisms. In addition, experimental studies and mechanistic human studies have suggested additional proposed benefits on the kidney that are not mediated through glycemia or metabolism. These include effects on immune system activation, inflammation, fibrosis, and oxidative stress within the kidney. Whether these provocative secondary outcomes and plausible benefits in terms of mechanism have clinically relevant benefits on clinical kidney outcomes is currently an interesting and active item of study. For example, here are two ongoing clinical trials of semaglutide, the FLOW trial and REMODEL, that are evaluating the kidney-specific effects of the GLP-1 receptor agonist semaglutide. FLOW will be the first large kidney outcomes trial among people with chronic kidney disease, and REMODEL is planned to be a mechanism testing trial that's done in parallel.